Hello, everyone. Um, at some point, I was a Girl Scout leader, and we would say, "What do we say?" We say "waterfall," and the girls would say "shh," and we quiet down. So I am so proud to be here. My name is Dr. Avi, and I'm officially here as the American Academy of Pediatrics chair of the Climate Change and Health Committee. And welcome to H3SD 2025, third year in a row. Um, and we have a long program, which is fantastic and wonderful. I'm so grateful. And so just welcome on behalf of the AAP and then our partners from Kaiser. Not that I don't want
Thank you. Thanks for being here. I mean, this is early in the morning, but on a Saturday, I know. But it's just impressive what these folks have done to put this together. This is about our future. So to look out in the audience to see so many young faces, it's just amazing. Every single year for the past 3 years, it's been growing. So it's really a testament to what our needs are. Here we don't look at short term, we look at long term, right? 10 years, 20 years. Think about it, 20 years. This is going to be an issue unless we act now. And if you look at the lineup of speakers, it's amazing. We're going to have a start opening that's really talking about the heart of the future. And I think we have both of that, and it shows in this room. So I really am so honored to be here, to be part of this. But these two are the double trouble or wonder twins, however you want to look at it, but they get things done. They get things done now. So thank you very much.
I completely agree with the complaint about this. I think it's a pleasure to see each year the conference get better and see more people here showing up and caring about environmental justice and the health of our communities. We're very fortunate that we have speakers coming all the way from LA, Riverside, Hero Valley, obviously San Diego. So our footprint has expanded, and I think we're so grateful for the work that the Wayne and all the different folks who have helped us together. I particularly want to thank Allison Pike for all the work that she's done. Um, Rachel Hahn as well, Justin Buchanan, Lauren Trin, Lauren Cueto, Jaden Tunnel, and Tria Danawa. Thank you so much for all your hard work. I really do appreciate it. And for our guest speaker, or our keynote speaker, Sayanti Halobapavan is our new public health officer for the County of San Diego. Thank you so much for being here. I want to say a few things to recognize it. He told me not to, but I think I have to recognize that he's been an amazing advocate for our communities. He should be recognized for all the work he's done. He's a board certified public health and preventive medicine physician with extensive experience leading public health initiatives both in New York as well as San Diego. He's played significant roles with all of our leaders as well as our advocates and allies here in San Diego. He takes over the mantle for Dr. Wooten, who was the inaugural speaker for the Heat and Human Health Summit 3 years ago. So thank you for continuing with that legacy. He was involved, obviously, with many of the challenges that we encountered in San Diego, the COVID-19 pandemic, the hepatitis A, the meningococcal, as well as the Zika outbreaks. He holds a master's in public health from Columbia Mailman School of Public Health, as well as medical degree from New York University School of Medicine. He's been recognized with numerous awards, including being named the San Diego County Top Doctor in 2022. Sayon, thank you so much for taking the time to be able to listen.
Good morning, everyone. I'm gonna switch to microphone. And can you hear me now? Okay. So thank you so much, Dr. Luis, and thank you, Dr. Will and V. And as you can see, I tend to be on a first name basis if I can, because we're I'd like to take away the power dynamics, right? Like we're all here, we're all humans, and we're all trying to make a difference. And it doesn't matter, it matters to our patients, and it matters to some people, and it matters to the work we do if we have an adequate degree. But amongst friends, hopefully people are comfortable with me calling first names. So my name is Seon. You can just call me that. I am your relatively new public health officer, but I've been here for 10 years in San Diego County, starting as deputy health officer and different roles. But I have always been interested in climate change and the impacts of climate change, right? There's a lot of different things that motivate us to be here today. It's a Saturday, you're taking your time. It's a busy day, but there's so much potential for learning. And many of you, I'm speaking now, but many of you are going to be presenting to us throughout the day, whether it's here or posters, etc. We are so grateful to be able to learn. We're so grateful that people are taking time and you have heart and dedication to do this on top of many of the other things that you're doing. Some of you are clinicians or community health workers or students, etc., and you have seen firsthand the impacts of extreme heat on your patients, on your friends, on your family. How many of you would say that you have seen the impacts on individuals? Thank you. And maybe even yourself. Right? So the world is changing. And we are in human history, right, at a crossroads. And so what are we going to do at this crossroads? There's a larger kind of question and more meta question about what we as humans are going to do. But while everything that is being understood and being addressed, there's going to continue to be effects from even the extreme heat that we're dealing with today, which, as Dr. Sang just said, is only going to get worse in the next 20 years. So we have to think forward. We have to look 10 steps, 20 years ahead and look to the future in terms of what are we going to do. With that, thank you for being here. It's going to be a wonderful day, and I'm going to hopefully just take you through a little bit of a journey just to better understand extreme heat and the health impacts. And I also just want to say sorry. When I was getting my master's in public health at Columbia, they allowed us to also take courses at the School of International Public Affairs, and I was always interested in climate change. And so I took several climate change courses and just learned, what was it? That was the early 2000s. So and it's come a long way, and I'm so glad to see it get the attention that it really deserves. All right. I can see here. Sorry. So this is just going to quickly talk about extreme heat. I know we're a little behind on time. The health impacts of climate change. You're probably not surprised to know that climate change is a public health crisis. You don't need me, the public health officer, to be telling you that. That should be very obvious. This is one of the biggest, if not the biggest, existential threats that we as a society are facing. And thankfully, the medical, organized medicine has agreed. I think it's taken a while, but to come to this place. But as you can see, in 2019, that 74 groups, including the AMA, the California Medical Association, American Heart Association, many other health-related organizations, did sign on to this letter or declaring that climate change is a public health crisis. So there is uniformity and agreement. So that shouldn't be the issue. You should know that amongst the health and medical community, there is broad agreement and consensus that this is a public health crisis. And therefore, we have to think about this, how it impacts our patients, how it impacts their communities, because it's one more thing that people have to deal with in addition to everything else. You can see some of the ways that it impacts health here, right? It threatens and harms human health. There's more frequent heat events. There's more wildfires and smoke. I don't know if many of you have, there's an app that I have that tells me every time there's a fire in San Diego County, there's a lot of fires. If you watch, if you have that app, even though most of them are very tiny and get put out pretty quickly, you're just in fire season that's extended much more than what it used to be for many of us. Even in the 10 years that I've been here, there's increases in allergens. That's a quality of life thing, but to some people, are severe, suffer significant and so this has made it a lot worse. It's not just a quality of life for some individuals. individuals. And then it alters environmental conditions. And this is what I deal with a lot, fosters the spread of infectious disease. We have mosquitoes spreading diseases in San Diego County that we did not have, diseases that we didn't have 10, 20 years ago. Right? So things like dengue, things that were traditionally more tropical diseases. And so there's so much we can talk about in terms of climate change. I love this slide because it really goes through all of the various kind of themes or domains of how it impacts human health. And please, I never want to forget that red circle around there. It's not just physical health. I think a lot of people, it's easy to get sucked in and think about, hey, this has physical health impacts, but there are mental health. When we think about health, right, we always have to think broadly and define health broadly. It's not just physical, mental health as well. And so there's mental health impacts. I'm only going to talk quickly about extreme heat, along with my friend and colleague here, Nick. So who is at increased at risk of heat-related illness? Everyone is a short answer. But of course, some people are at higher risk. And that includes these groups that you see here, and including even healthy individuals like athletes. But then other individuals who are at higher risk are people who work or play outdoors, older adults, children, people with chronic conditions, people without air conditioning. A lot of San Diego infrastructure was built back in the day, and San Diego's known for having a temperate climate, and so air conditioning wasn't always built into certain households, and so that is something that's being retrofitted into some households, but not everyone can afford that either. So heat-related illness is a thing, and it continues to be a thing. And when you look every year, kind of the typical year, in terms of what people are dying from when it comes to climate change, it is heat. Heat is the number one killer when you talk about the different things that people are dying from that are attributable to climate change. So extreme weather events. And you see here in 2024, just last year, we had 21 deaths. That is 100% preventable, related to hyperthermia and heat-related illnesses. 158 heat-related ED, emergency room discharges, and then 41 hospitalizations. Right? We know that deaths are just the most extreme outcome, and there's a lot of pain and suffering, but there's also a lot of suffering, pain, and other things that come along with just going to the ED hospitalizations. And of course, there's things that are maybe a little less severe, but still impact individuals, and again, their mental health. And so how does extreme heat impact health? There are things like heat exhaustion, heat stroke, which I'll talk about. And what it is that when you have a higher temperature, your body is working hard. You want to maintain that sweet spot, that internal core temperature. And so when when it becomes hotter, then you're trying to do things like perfuse more. You're trying to change your blood to go more to the periphery, and so you could sweat more, things like that, so you can get rid of the heat. But then when it's really hot or when it's really humid, you can't sweat to get rid of them, to get rid of some of your or lower your temperature. And so sometimes, especially with extreme heat, then you end up in a scenario where your body is overworking and you're not getting the outcome you want, and it causes longer-term damage to some of your vital organs. When I say vital organs, like brain, kidney, and then heart and other muscles. So there are impacts and risk factors like you see here that may put you at higher risk for that. So these are some relatively older pictures from the CDC, which is why maybe a little bit, but I like them just because they talk about heat cramps, heat exhaustion, and heat stroke. So these are just on the continuum of how your body reacts, as things heat up, so to speak, as your body, as conditions get worse. There are different symptoms that you want to look out for, and of course, different treatments, mitigation strategies, depending on the level that you're in. Right, so heat cramps is much different, and I'll go into, might be easier to actually talk here, the heat stroke just being the most emergent one, and where it is a medical emergency. And sometimes in heat stroke, people aren't even sweating anymore. And so you might think that they're better because they're not sweating anymore, but it's the opposite. that their body can't stop sweating because they can't sweat. So this is real true mental emergency where you want to take these steps here, and you will have copies of all these slides. I believe I understand. This is just another way of expressing what's on the last slide. Maybe it's more easier to fashion signs and symptoms. And then just tips to stay safe, stay cool, stay hydrated, stay informed. I do want to also, just because speaking about climate change at a broader perspective, next year I'll switch out the picture about include a plastic bottle. Sometimes you have to. I get it. Sometimes, that makes sense, but where we can avoid it, we'll respond to it, right? So what are we doing to address this and mitigate this? There's a couple things, right? And again, this is not something that government can do alone. This is something that we all need to collectively come to the table. But what is a framework in which we operate to even look at this and think about how we should be addressing this? That is this BRACE model, CalBRACE. So California adapted the BRACE model, which is building resilience against climate effects, from the CDC and adapted it for local purposes. And so that, as you see here, has these 5 steps: forecasting, projecting the disease burden, assessing the public health interventions, developing and implementing climate and health adaptation plan, and evaluating the improving quality of activities. So even though it looks like a fairly simple model, of course, look at it, there's a lot of work that goes behind each one of these steps. What have we done? So again, we are only one component of it, but from the county perspective, county government perspective, right, we have done a couple things. We have to lead it, we have to lead on this alongside many of you, like those of you who put this day on. So the disseminating data is one of the big things. Education, of course, there's still a lot of education. There's still a lot of people who may not know it. And then remember, a lot of our patients, our communities have competing interests and priorities. So when it comes to heat season, sometimes it's good to have reminders right in the moment, because people maybe are more paying more attention to this particular topic and what those signs and symptoms to look up for example, or where to go if they don't have information. Places like the cool zones, which is at the bottom, which we operate, the county and public health services operate, which are places where people have to have good air, who don't have access to air conditioning. And especially that's important because some people not only have access to air conditioning to cool down their core body temperature, but some heat events, particularly those in rural and backcountry, sometimes it doesn't cool down at night. When you don't have overnight cooling, then your body, if you don't have air conditioning, you don't have the ability to recover, so to speak, right? Your workload for your body has been higher during the day because it's hotter, even if you're staying inside and it's fanned, things like that. But then you want to give yourself a break. If you don't have the ability to recover because it's not cooling down overnight, then we definitely so more proactively during those times when nighttime temperatures are higher. And then of course we create response plans again by ourselves. We put out health alerts for the physicians in here. Are any of you subscribed to our health alerts? A couple, thank you. And if you're not, please subscribe. It's free. And we provide health alerts on all types of things, right? Like infectious diseases, cases, outbreaks, things like that. And so, but I realized that we had never put out one about heat. And every single year we have high heat. And this is, like Dr. Singh said, it's only going to get worse. So we need to provide guidance and reminders to our provider. We're the ones who are on the front lines and actually see who are impacted, and so they can give anticipatory guidance, so they can understand and talk to their patient community around heat and how to remain safe in extreme heat. So this is a health alert example, a screenshot of the key messages that you see there, screen for Reliant Plan. And so this is something that we just started doing, just put it out a week ago. And every year I want to put this out. I will admit I'm still subscribed to New York City's health alerts. They do this every year, so that's when I got the idea. This wasn't my full total idea. And so there's just some data that go through it. Well, level data, but some of our pre-hospital heat incidents. So even though a lot of us work in clinical outpatient and inpatient settings, there sometimes there's a way that you can get to those settings, and that's often by EMS or ambulance, fire department, right? So the pre-hospital system, and so we have access to county EMS. They have access to key partner, and at one time I was over county EMS. They do provide us and share a lot of data with us of the types of patients that are coming in. And so you can see here the ages is interesting. 15 to 24 being the largest age group that's impacted, and males, 68% of their cases there. Up in this slide, really the only thing I wanted to show you all is that you see that significant number of those transported to the hospital on the top right, and then on the patient acuity on the bottom right. Even though, yes, most of them are classified as mild is still enough. Mild is still something that was enough for someone to know, right? So I just don't want to, minimize someone's experience, but it's called mild there. And then this is probably no surprise to anyone, but the hospitals that was transferred to on the left, the largest one, significantly was on the sharpest one. And this is in a 5-year period. So obviously on the top left, which has a large catchment area in Palomar, which is a catchment area for some of our north places where typically when you talk about heat waves, there's larger, hotter temperatures. Those areas. So, and then of course, but again, this is a team sport, guys, and every hospital is impacted, right? Here, and then there's response agencies, and this is where the incidents occur. So you see, it is, even though I talk about this and the higher temperatures in some parts of the county, it is every San Diegan's everywhere. And then here we have some resources for healthcare professionals. There's a brand new tool that just came out called Cal Heat Score. The state is dumping millions into this tool to make it more proactive. We just got all our cool zones on this tool. It's going to be, I don't think it has the feature yet, but it's going to be able to proactive push notifications when there's heat events anticipated to where you are based on your location. Kind of like some other emergency apps that you might be aware of. So this is something that we are actively trying to promote. Just yesterday, we were talking with the state about getting us more informed about it, so we can inform the public more about it, and partners about it. So I think with that, I'm sorry, one more thing is that this, we do, again, education is just a core foundational part of public health and any intervention. Everyone at all levels can benefit from education. So this is a heat risk curriculum. If you are here, you are probably already aware of many of the key points, but it might still be there might be some tips that you can still learn from this. So there are 6 modules in here. It's accessible from our website. We are really trying to push it to the people who are trusted messengers to one, so that they know. And I see one of my health worker friends here, Juan, and we're trying to push this to the people who we know have influence to it. So we use this what's called a Residence Leadership Academy. Members, really community-driven model, train them to become community leaders, and of course also working with other organizations to train those in their community. You don't have to be an expert to help your community. And though many of us consider subject matter experts, you do not have to be an expert to do something, whether it's something else. So thank you for that, and I'm going to pass it to my friend and colleague Nick, who leads who's part of our public health preparedness and response branch. He's on this issue.
Thank you so much, Sam. I appreciate everything, and thank you for giving me a very hard act to follow. Like you said, I'm part of public health preparedness and response. I'm one of our emergency medical services specialists, and I'm one of the leads for our extreme heat response plan with the county. Going to walk you through a little bit of what that means, some of the purpose and history of the plans, the overview of past heat events, and who we work with for that heat plan. We're also going to look at the plan itself a little bit, how we collect data, resources, zones. So The purpose is to establish guidelines for responding to an excessive or extreme heat event within the county. Probably kind of goes without saying. It's not just within public health preparedness and response. We work with a lot of different branches and groups within the county of San Diego itself, as well as external stakeholders as well, like SDG&E, 211, lots of different programs within the county of San Diego. It was developed originally to mitigate effects of excessive heat across the region. We've had lots of really high temperatures. I don't think I need to tell anyone here that. You all get your updates on your phone probably daily and get to see when we have those nice 90-degree days along the coast. And if you're inland at all, we're pushing 100 relatively frequently. Here we have some data going back to 2013. A lot of this is gathered via National Weather Service with NOAA. You'll notice that 2024, it looks like there's a little bit less going on with that trend upward. But if you actually look at the number of days covered by each heat event rather than just the number of total events, you'll see that we have still a pretty nice trend upward. A member of my team actually let me know today that looking back through and coming through data again, there was an update since we made the slide, so that last date should actually be 56, not 46. So we have that nice upward trend moving through. This year, we've had a slightly smaller number of heat events so far, but about half of the month of August has been a heat event. Also, looking at some of that hospital data that we looked at with Seon as well, we have the number of heat-related incidents across 2023, and you can see when it peaked then. That's not necessarily going to be the same year to year. This year, it's likely we're going to have a little bit more of a late heat season. Early heat season, like this was a lot of late July, early August. Within County of San Diego, we have a nice list of all of our internal stakeholders up here. I'm not going to run through them one by one, but you can see it really is a full county effort. It's not just one group looking at heat and seeing how it affects folks within our community. Lots of groups. And we have external stakeholders as well. We work really closely with CDPH, Cal OES. A National Weather Service really informs how we operate and activate our heat plan. And SDG&E really helps with making sure that we have power where it needs to go and are able to make people aware if there's going to be shutoffs, especially within our medical and fragile communities. You can see here, heat's nothing new. We have stories every year about excessive and extreme heat. Over the past year, we actually have switched over from the excessive heat terminology to extreme heat. That's something that has come down from the National Weather Service. They're changing that terminology a bit, so we've been working on updating all of our language. And every other year, we update our heat plan with a pretty big overhaul. 2025 was one of those years. So we have brand new extreme heat plans, both for internal county folks, as well as for our consumer version, which can be found on our Extreme Heat website. And then in the center, you can see the concept of operations, which is that more nitty-gritty, who is doing what when there's heat activation within the county and within those stakeholders that you saw before. I'm going to be flipping back and forth between these two slides here quite a bit for a moment, because this is the meat of our heat activation within our heat plan. See that there are 3 primary phases depending on the intensity of the extreme heat event and how it's affected. National Weather Service breaks County of San Diego into 4 different regions. There's the coastal region, the valley regions, the mountain regions, and the desert regions. Because as I'm guessing you all can imagine, if it's the summer, it is very frequently hot in the desert. I feel like that pretty much goes without saying. So a lot of times there's a heat warning, which is going to mean the temperature exceeds the average by a certain amount. According to the National Weather Service, that's going to be a heat warning. When it's a heat warning only in the desert, that's going to, for example, be a phase 2. Now looking at this NWS heat risk grid, you'll notice phase 2 is going to be 2 and 3. Usually that means it's going to be closer to a 3 value in this heat risk grid within the deserts. Now, heat advisories only happen in the other 3 regions, and those will also be a phase 2 heat alert. If any of those other regions get pushed into that level 3, other than the deserts, we're going to be moving into a heat emergency, which means there's going to be a little bit greater activation, more likely that there's going to be a call held between the stakeholders mentioned for that heat plan to determine what extra steps are going to be taken to make sure the communities can be kept safe. And of course, that value 4 is definitely going to end up being an extreme heat warning. You can kind of see the heat risk values have a little bit of crossover, but 4 is definitely going to end up being one of those heat warnings, especially if it's anywhere outside of deserts. Now, some of our mitigation strategies are our cool zones. I'll be delving into those a little bit more deeply here in just a few moments. Infectious disease prevention, especially when it's hot, you have a lot of people congregating in indoor areas. So thinking about infectious disease prevention is really important within our heat plans, and messaging that goes out via communications, whether it's county communications or other partners. This is our county website. It's not the entirety of it. There's quite a bit more going down with mitigation strategies and other resources. But this is a great place to go to get a nice overview of what extreme heat looks like for the county. And it's also where we have that consumer version of our heat plan. Now, for cool zones, there's a link to cool zones on this page. It might be a little further down, actually. It's shown, but the cool zone program has cooling centers or cool zones. They're air conditioning facilities that can provide nice relief during those hot times. Public Health Preparedness and Response just took over that program this past year. It used to be part of Asian Independent Services, but as it's reaching more and more outside just our Asian communities, we want to make sure that it's advertised a little bit further out. Also, if people aren't able to necessarily find them as easily, they're able to call and figure out where those might be. We have a lot of online resources to find them as well, and it really can help people either when it comes to saving money or if they don't have air conditioning. These are great places to go. There's a lot of partnership within cool zones as well. SDG&E helps provide some funding for the program as well as education for the cool zone sites. And they extend from public community centers to private organizations. And there's a lot of coordination within the county with these cool zones every time there's a heat activation. Public Health Preparedness and Response, like I said, manages the cool zone program. Every time there's a heat event, an email goes out to all of our cool zones, letting them know about the event, the duration, where it is, what to expect temperature-wise, both during the day and at night. And we also ask them if there's going to be any extended hours during the events, especially those events that have those really warm nights in some regions. That's really important to let them know that, hey, we might have people seeking help after what normal hours are. And sometimes we will get those extended hours from some of our cool zone locations. Just during this last one, we had one of our libraries have extend their hours by a couple hours for most of that heat event. There is a map on the Cool Zone website. This is an example of it. It shows every little Cool Zone icon is a Cool Zone location. If someone clicks on it, it gives them information about what that location is called, address, hours, phone number to contact if they need to call. And it's also going to be overlaid with our heat event information while that's going on. You can see this one had an excessive heat warning for a lot, basically everything up to the coastal region. Any public, private, or profit, not-for-profit organization can become a cool zone. There's certain standards of participation, like having working air conditioning. Occasionally, sadly, some of our cool zones have air conditioning go down during the season. At that point, we communicate with them as to when it might be fixed, temporarily remove them, and restore them once good to go. This year we've had 87 sites. We're hoping to be able to expand that in the future. So if you or anyone you know operates a location that might be a good Cool Zone site, direct them to coolzones.org. They can sign up for it or shoot me an email. Emails do go to me. And I'd be happy to chat with them about it. Next steps for our our year-end reporting. We're currently working on a little bit of a revamp with our reporting for our 2024 heat report. There have been some changes in some of our data flow for our pre-hospital information and hospital information, so we're working on getting that out. Hopefully a little bit later this year, and then 2025 heat report. Even though heat season is June to October, we can have heat events outside of that, so that definitely won't be coming until 2026. 2027 will be our next major overhaul for our heat plan. And of course, in the meantime, we'll be collaborating with our internal and external partners to make sure that heat plan can be as good as possible. Does anyone have any questions? I'll start with heat plan questions before I drag Sam back up. Let me get you the mic. That way those on the recording can hear you as well.
So 2 questions. One's for Dr. Seon as well. You quoted a number of one of the slides, 21 deaths and 158 ED-related incidents. From a clinician standpoint, I think we're way underestimating this. People come in, we call it as dehydration, but we don't associate it with heat. We just say dehydration, get rhabdo and treat them. So how do physicians or clinicians do a better job at capturing this? Is there an ICD-9 code related to that? That's the question.
I'm finding it right now, but a lot of that data is pre-hospital data. So a lot of what we get from that data is what's captured before people reach the hospital. So if there's anything captured after that point, that might not necessarily reach us. So those are going to be estimates based on pre-hospital data for us. But yeah, in all likelihood, if there's some other large presenting thing, we might not be capturing that.
There is, there's 2 different things. There's a couple of sources of data. There's the pre-hospital data, and then there's also data we get from the emergency rooms of the hospitals. That's all billing and coding data that our community health, a different team, community health statistics use. That data is usually lagged because it goes to the state. It takes a little while to come back for some reason. And but you're absolutely right. I'm saying, like, I'll just speak, or maybe I can speak on behalf of me. When I was practicing more, and up until this role, I was practicing provider once occasionally. But we're not always the best at coding. I'll just admit that, right? And so you're right. There's a lot of things that are happening. So you should look at those numbers as an underestimate. That is a really, really valid point to make. I can't tell you the degree of underestimation that may depend. Probably the death number is probably more likely to be closer to accurate because of the way we code cause of death versus the other.
Right, so education, maybe to the providers. The second question is really about the structure. Arizona has a heat czar for the state. Is there any plans for California to have something like that as well? Because we're seeing wildfires more frequent than ever, and popping up at any time now, not just during summer seasons.
No, nothing that I'm aware of. But again, I very much work at that county, slightly more granular level with our internal heat plan, and I'm not necessarily told what's happening in the kitchen or the chain.
I'm also looking at some of our team who helped create these slides. By the way, they're wonderful, and they're not aware of anything either. But we can, I think I want to look at that, right? How can we benefit? How can we promote that? We're talking with the state all the time, so if there's value in that, then maybe something worth considering.
Thank you so much. And to follow up on the question from Will, we hear from sports teams, especially opening Snapdragon, they get excessive exposure usually during big times. in all the marathons and extreme temperatures, things that are happening. Is there a partnership between the Department of Public Health and those entities to see if they can help mitigate some of those effects?
Critical point that if there isn't, we should, because how are we getting to a vulnerable populations? And when I mentioned who's at risk, we almost should have strategies for each of those different subpopulations. And so if we have structural places like our Snapdragon stadiums, then we should be partnering. I'm gonna ask Nick though, just because I don't know the details if they're one of our partners already. I know, SDSU.
We have not had any partnership with Snapdragon as of yet. I know part of that is the stadium design, unfortunately. Sadly, there is no real overhang area for the stadium design. But hopefully in the future, we'll be able to work a little bit more closely with them as far as what strategies might be able for mitigating.
Giving us a lot of great, really constructive thoughts and action items. This is how we move forward, right? But I want to say that during COVID, it was all hands on deck approach. I was at the emergency operations center. We worked with like the I forgot what the name of that group was, but it was all the athletic, the youth sports and everything. And there's a group of individuals who lead kind of a lot of the youth sports organizations across the county. So they're other partners publishing. Reach out to.
Actually, so that was source for us. I know there's also one in Miami and Arizona and others across the states. I'm concerned about funding, and so and California State's funding in this area. So I'm wondering if you have anything to say about that. And secondly, I know there's efforts to conduct syndromic surveillance to kind of enhance ability to describe impact of extreme heat on our populations. I wonder if you can comment.
First one, I just wanted to say that you're right that the reality. We'll look at the Arizona's are, heats are, and the heat officers, and but the reality that we're in is in a time of difficult budget situations on the local state. Of course, other changes like we have heard funding comes already for our public health preparedness grants at the federal level during this current administration. So there's a lot of challenges, but it doesn't mean that during challenges, during difficult budget times, you have to prioritize what's most important. And a lot of that is data driven, of course. We do have a medical director for the public health preparedness and response branch, but we have, of course, the leadership that makes leadership above him as well. So noted. And then the syndromic surveillance, yeah, we do syndromic surveillance, a lot of different things and do have an ability to look at EDs currently. We're initiated a longer-term project to also look at the community clinics because of something called the California Data Exchange Framework that requires FQHCs, federally qualified health centers, to also join local health information exchanges. So it'll take a little while to set that up, but 1 or 2 years probably. But that'll be really worth it from an equity perspective because who goes to clinics is often
Hi, thank you for everything you're doing. Lucky to live in a county that's been so proactive. I'm curious about your outreach to occupationally exposed populations and how you feel that's going and how you make partnerships.
That is something that is part of our heat plan. Our occupational health and behavioral health services teams do outreach and specialized communication during our heat events and heat alerts. We're also working closely with SDG&E to make sure anyone who's in a medically fragile population, if there are any power shutoffs due to heat, those people are especially excluded, or there's going to be communication with us ahead of time so we can make sure that we can get those folks set up.
I want to say that's a good thing for the providers. We should probably do our next health alert next year to make sure your patients who have certain needs, make sure that they qualify tele-SDG&E. Like if you have a CPAP machine or certain things like that, you can qualify and they'll know how to shop.
Hello. Thank you for being here. As someone who just moved here from Texas, I'm so glad to see that somebody somewhere is doing something about extreme heat. I'm an incoming student here at UCSD. So it seems like the focus of your response to extreme heat is implementing and organizing the cool zones, which is amazing. Though I'm wondering if the public health department has like an advocacy branch where you're trying to mitigate some of the root causes that lead to extreme heat, say advocating for like the electrification of buildings or efficient public transportation, some of these emissions that lead to extreme.
So
Yes, okay.
excellent question, and I know that Nick presented a lot about the whole plan, and the plan is much more comprehensive than pool zones. Even though I know we spent a lot of time on pool zones, because his branch oversees the pool zones, but Adrian is actually our climate change and health lead for, and she sits in our office, public health administration.
Yes, hi. Thank you for that question. And we have a lot of strategies that address climate adaptation and mitigation. So we are not, we're trying to be proactive, addressing upstream approaches, healthy food systems, active transportation programs, the works, identifying funding opportunities when we can to implement all of these projects. It's a reprioritization. So yes, and we can do more.
It's great. You tell us.
Hello. I have a question regarding the development of San Diego, so there's a lot of construction happening. And I wonder what's being done to make awareness for construction workers, roofers, and even factory workers. Because yes, cooling zones are a good idea, but what about the workers that are out there working under the heat every day, and most of them don't even have an opportunity to access these resources because it's not in reach. So what is the county doing? What's the county doing?
No, you're right that especially when you look at a lot of those populations that I said were at risk, right? If you're an athlete, if you're organizing a sport event, you can say, hey, it's too hot, it's sad, cancel the event or something like that. If you're working, that is your source of income, you have a lot less control sometimes of whether you get a situation where you're likely to encounter extreme heat. You're an outdoor laborer especially, right? And so you're absolutely right that this is a very critical population of different strategy. We do work with our comms team and our county communications team. Of course, whenever there's heat alerts and things like that, we put out stories, we put out social media, put out a lot of information, and we have a team of mostly nurses actually who are ready and media trained to talk to the public, not just about pool zones, but really about what to be doing. If you are working outdoors, wear loose fitting clothing, things like that. But get shaded area, get access, take breaks, stay hydrated, those types of key messages. But the messages are only important if they are resonating with the populations that need to hear them. And some of those are the low population. So I I would say that's why we're all here. We need a coalition of partners. And my friend Juan again, right? Health workers who speak different languages, go into those communities and extend those messages, because we can't be everywhere. We probably need to do more, but we can't be everywhere. So I think if you get on our lists, then you will get alerted when there's a heat event, and then you and your organizations can extend that further or share our social media and things like that. So, but we probably need to partner relay. Oh yeah, so we do have a group that works on something called partner relay, and so that's with our Office of Emergency Services and then Health and Human Services Agency, and we have the ability to take a lot of the messaging, a lot of like time sensitive things that we need to communicate, translate that to multiple languages and culturally competent ways, and that we have a whole list of community-based organizations that we then work with to extend that message to, who have reach into those communities. So that has been really successful, not just for heat events, but for a lot of various challenges.
So I have a follow-up question to you. What's about like the employers? So do you have any I guess like relationship with the employers? Because yeah, like workers, oh sure, because workers can like access like social media, but if their employers are not aware of it, then they're like, oh, you can take a break or things like that. Like what's being done to address that?
I don't know that we're working. Okay, yeah. Sorry, I know more about it.
These are great ideas. We'd be happy to maybe in future Heat and Health Summits, maybe talk about some of these other options. But there is a program called Live Well at Work where we are outreaching to employers. There's also a Live Well San Diego business sector. We have a lot of partners in the business. We could always, of course, have more. This is a big business community. And yeah, there have been some strategies where we're helping them develop, wellness policy, what to do in certain events.
Thank you.
Hi, thank you. I'll make it quick, but I'm curious about kind of like the heat activation, the heat alerts that you talked about that seem to be triggered by the National Weather Service heat alerts, advisories, and warnings. I'm wondering a couple of things around that, like how I'm assuming that you are in touch with the local weather forecast office and y'all's alerts are somehow linked. Do you issue different alerts? How do you disseminate those to the public? And then do you have any sort of like effectiveness assessment where you're like actually sure that people are reading, able to understand these like public heat health alerts?
I can definitely touch on the side of where we get the information and activate from. National Weather Service activations are going to be the same as ours. They determine a heat warning or heat advisory based on a percentage change from what the average would be. We used to have a chart with set temperatures, and that obviously changed as data has changed because each day it's going to be a slightly different set point for that advisory or warning. That said, what we do within public health preparedness and response is we let everyone in the county know. So our communications teams are part of that communication. So then they're going to be using their platforms, whether that's blogs, social media, local news. I know Sam mentioned our nurses will be going on the news to speak about that. And we also have pretty strict guidelines when it comes to language used when it comes to public communications. That way we can try and make sure as best as possible that it's going to be at a comprehensible level for the entirety of the county. That said, it is a lot of communicating out without expecting much back when it comes to general public communication. And we could probably talk more about strategies for getting more return feedback on it.
Thanks.
Well, thank you very much. I know there's a lot of questions. This is wonderful. This is wonderful. I want to first thank our public health officers, for being here, and Seon for leading the team. When I was just sitting here listening to all the questions, the quote kind of popped in my mind. A society grows great when old men plant trees for whose shade they know they would never sit under. That's what we're doing here. That's what they're doing. I love our public health officers because they're thinking that far ahead. And you, from where you sit, you're already getting ideas of what you can do, asking the tough questions. I know he doesn't have all the answers, but all the answers are in you as well. So I do want to thank them one more time for being here and presenting, and the whole team.
Thank you, everyone. Wow, it's the third year, and every year it gets better. So to continue the tradition, because really this was inspired by our County Health Officer, Wilma Wooten, is on behalf of the entire organizing committee, which is all the students, multiple organizations, all the different hats we have. Given that it's about decarbonization and heat, but we are all trying to reduce our plastic, we have a special gift for you.